You're listening to the Happiest Lives podcast with Jill Lillard, episode 118.
Welcome to the Happiest Lives podcast, where you'll learn to think better, feel better, and become the woman God says you already are. Here's your host, Jill Lillard.
Welcome back, friends. We're in the middle of our Hormones, Happiness, and the Holy Spirit series, and today's episode is one I've really been looking forward to sharing with you. If you've ever felt like you're doing all the right things, journaling, praying, and trying to take your thoughts captive, and emotionally you still feel stuck, discouraged, or just plain exhausted, this episode's for you. Today, I'm joined by a very special guest, my husband, Dr. Richard Lillard. I like to call him Dr. Baby Cakes. And actually, as we're recording this, he is upstairs in his office, and I'm downstairs in my office. And we're just doing a little Zoom call here so that you guys can have better microphones, that we each have access to a microphone this way. So Rich is a psychologist. He and I actually met working at Children's Division for Child Abuse and Neglect when we lived in St. Louis. So that was about it was over 25 years ago. 27 years ago. That's when our love affair began. And after we got married, we ended up moving to Chicago, the Wheaton suburbs, where he did his doctorate in psychology. So I'm going to let you say hello to everyone and introduce yourself a little bit, Rich.
Like Jill said, I'm Rich, Dr. Rich Lillard. I'm a clinical psychologist by training. So I have a master's and a doctorate in clinical psychology. I got that from Wheaton College right outside the Chicago western suburbs. I spent the better part of my career as a therapist and psychological evaluator. Jill and I met, as she said, working with Child Protective Services in Missouri, where I did foster care and adoption work for a number of years before grad school. I always intended to be a generalist, to meet everybody at a certain point and then partner with them and then know also where my limits were and where maybe they needed additional help and be able to refer them to specialty. So all my career choices initially were that way, but it was also a lot of God involved in that because I never anticipated some of the career opportunities that would come my way. I spent about 20 years working as a clinician in the Medicaid population, where I worked at community mental health centers and federally qualified health centers, helping build some integrated behavioral health programs within primary care settings. I did some consulting work helping other sites build those. Along the way, I also received a postdoctoral master's in clinical psychopharmacology, just thinking that would help with the consulting work I was doing with some medical providers at that point in time to help do holistic care for the patients and clients I was seeing and working with. And then along the way, Jill and I and a third partner were able to open a private practice, which Jill may have referenced at different times, but we operated Lifesong, where we employed a lot of different providers, a lot of different individual therapists, psychologists, social workers, counselors, doing things. So I feel like I got a wide breadth of experience from the clinical perspective. And then for the last 2 years, I'd made the move into the managed care space, where now I work for a large insurance provider, helping oversee sort of the services, again, in that Medicaid population in the state of Missouri.
You've always worked with a lot of really intensive cases, people who've had lots of trauma, who've had ongoing acute depression and a lot of mental health issues. And this is the first time you're on the business end of things. So that's a little bit of a change, which is probably needed after many years of doing this work.
And I always think when you speak to that about working with that population I worked with all those years, when I speak about the Medicaid population, I think one of the things that's really important to know is there are a lot of people with serious issues there, and there are not always a lot of options for them to seek treatment. So I always felt like it was in a lot of ways a privilege to be able to do some of that. And then to be in positions where I was helping lead up a line of business that maybe a medical center would not have been focused on, and not just treating the clients I was working with, the patients I was working with, but also educating that organization. And then doing some of that statewide consulting I was doing, also kind of enlightening other folks to the importance of integrated care. You establish your care and rapport with your medical provider. Sometimes it's hard to walk into another office and just start pour your guts out to a stranger. And this way, I think it was a lot of times easier because they already knew their doctors and their doctors could then introduce them to me. And there was a transfer of that rapport, which I think just made it easier.
Yeah. Yeah. So the relationship between people who are managing their physical care, their medication, within your role as a psychologist, so I know sometimes people get confused out there. So just to explain us, a psychologist isn't going to prescribe medicine where a psychiatrist will prescribe medicine. And yet your psychologist or your counselor is the person you're talking to on the regular. And so they're going to be more connected and aware of how you're actually doing. So when you're doing that integrative care, you're able to communicate and work together more as a team, which really flows into this podcast series. We're looking at the relationship between all the parts. There's the mindset part, there's the physical part. And so as we're talking about mindset, hormones, brain chemistry, how it all works together, from your experience, how do mood disorders like anxiety, depression, how do they actually show up in a person's life, not just in a textbook?
I think one of the things that's really important to know is anxiety, variations in mood, all of those things are normal and important part of daily life, right? So there's a certain amount of anxiety everybody should have just to spur you to movement, right? And I used to tell clients this all the time, that there is physiologically zero difference between excitement and anxiety, that anticipation or dread of a future event you're unaware of, the present under the tree or the letter from the IRS trigger the exact same biological experience. So part of what's important to realize, it's not a warning sign that you have a bad day. It's not a warning sign that you are feeling a little overwhelmed or that your brain's racing about something. So it's just a matter of degrees. Am I able to do something with these? Am I able to use those as fuel to propel me forward? Or do I let those experiences engulf me, overwhelm me, and incinerate me?
Yeah, and I know we've talked about like that continuum of we're all somewhere on the scale of being bipolar or having an anxiety disorder, right? Because we're human. And so we're going to experience all the feelings. And so I know a measure like with the DSM and diagnostic manual, the big measure is, are you experiencing this more than half the time? Is it interfering with your life? And so that's where it becomes more probably a diagnosable condition in addition to the grouping of symptoms.
Yeah, I think the best way to break that down is like situational versus clinical. That I think there can be those situations in life. If your dog gets run over by a car, if someone you love gets a terminal diagnosis, if something unexpected happens with a sudden job change, those things are supposed to trigger you to have a reaction, right? If you can Google like the top 10 most stressful events in life. And those top 10 stressful events, half of them are super positive. Half of them are a new job, a new house, a new relationship, right? It's the change. And so it's recognizing, again, when that natural adjustment phase that kind of comes from a sudden event lingers. And it lingers to such a point that you get stuck. And that stuck nature, and sometimes I think it's a mindset piece too. I think that speaks to the series you're on right now. But that mindset piece of, have you become hyper-focused on it? Have you, in some ways, claimed a piece of your identity wrapped around this? I'm always this way, or this is just who I am. And you surrender in some ways into it, give it power over you. I think that's where it's tricky as well. Now, there are sometimes I think people don't have power to pull themselves out of those early on. In some of the situational situations, I think there is a mindset change, a behavioral adjustment that you can do to spur movement. Physically as well as emotionally.
So what about those who are doing the mind work? They're renewing their minds, journaling, spiritually, they're praying, and yet they still feel stuck. What might be going on when the thought work isn't enough?
Hey, I wanted to interrupt this podcast for a minute. If you've been listening and thinking, this is exactly what I need, but I don't know how to actually do this in my life, I created something for you. It's called Clarity and Courage, and it's my monthly coaching membership for Christian women who are ready to stop spinning and start moving forward. You get a mix of self-study and 2 optional coaching calls each month. So you've got structure to stay focused and support to know you're not doing it alone. And right now you can get it for less than $2 a day. You'll find the link to sign up at myhappyvault.com or thehappiestlives.com. All right, back to the episode.
Well, I think at that point, that's when you start to say, maybe there is something clinical going on here. There may be something that is outside of my power to physiologically, psychologically, some sort of biochemically. Being Christians is we recognize that we're broken, that we are somehow inadequate. and that there is a piece of us that needs something more, that, that craving for heaven, that craving for a spiritual component of our life, the humility that comes from not being perfect. And I think if you can own that and say, okay, I've gotten to that place now where I can't just will myself out of this. I can't just behaviorally change this. I can't just start walking an extra lap around my neighborhood and that'll snap it out. That maybe then I need to take extra steps to fix it. It may be similar to me to when you get into your car and you drive it down the road, you might occasionally hear a little noise or feel a little vibration or something that just seems a little off. But there's a point in time where you're like, I probably should take that to the mechanic. It's not going away. It's becoming more prominent. It's causing me more concern. I need to take it in. And why would we do anything different for our mental health and wellness than we would do to something like that?
Yeah, that's a good way of looking at it. So what's actually happening in the body or brain when someone is struggling with depression or anxiety, for example?
I'd like to say it's universal, but there's different, and people probably know some of this about different neurotransmitters that are involved in brain chemistry and the functioning of our psychological health. But different neurotransmitters are released at different points in time, right? And some of those are pleasure, some of those are anxiety provoking, some of those are meant to mediate different experiences. Those are constantly being released, right? That's the human nature of it. But there are some folks who I think their bodies just either don't process that in the same ways, or they're processing it, I'll say differently, which is pretty much the same thing I just said. And it's just what needs to be done to mitigate that. Again, I can't not equate it to a physical thing like diabetes, right? Diabetes is an insulin-related disorder, right? And some people's body produces enough, some people's bodies process it a certain way, where other people's bodies don't produce enough or process it differently. And what sometimes that causes is a need for you to see a medical provider to manage your insulin in such a way that you can function. Similarly here, people talk about chemical imbalance in the brain, and I'm probably getting way into the weeds here, but our bodies are built for something called equilibrium, right? There has to be a certain degree of balance. So it's not that it's imbalanced, it's just that your balance is different than my balance. And so I think for some folks, it's just comparing ourselves to one another is an act of futility because everybody's body processes things different. So there'll be some people who can handle a higher degree of anxiety, some people who can handle a more prolonged period of depression, or other people that might throw them into a clinical episode. And so it's just recognizing your own personal limitations and challenges, and then realizing, when do I need to take the car into the mechanic?
And how much of that do you think is genetic that we inherit from our family?
Probably more than we realize. That whole nature versus nurture argument that everybody knows about. But how much of what we're doing is learned because we've watched other people do it, and this is how they process it. This is how they deal with their anxiety. This is how they deal with feeling overwhelmed. And so you start doing the same thing. And then it becomes like a natural tendency. And then at some point, you can do this too, where the behaviors will trigger the emotion because we're such creatures of habit, right? So if we start doing the thing we typically do when we're anxious, that will almost generate anxiety because our body's familiar to that pattern. And because I know I've done it before, I'm like, why am I getting stressed? And it's because I'm in the middle of a cycle of something I typically do when I'm stressed. Mm-hmm. And so your body creates meaning to that action. And it can almost send you in a spiral then where then you start looking for things. And then the self-fulfilling prophecy nature of humanity is I'll find something to worry about. And then I'll attribute all of that to that. I always talk about, and this may seem like a rabbit trail, but I remember there was a time in my life I had gotten a planter's wart on my foot. This is not a psychological argument, but it's more of a discussion about just how things can build on one another. I'd gotten a planter's wart on my foot. And rather than go to the doctor, if you guys have never had a plantar's wart, they grow internally, not externally. So they grow into your foot, which becomes very painful to walk. And it was near my heel. So I'd started walking on my tiptoe slightly at first, and it got more pronounced as the discomfort got there. And what I had done, because I didn't realize this, but like a couple months later, maybe a month later, I started realizing I was having really crazy headaches, frequent like migraine headaches. And I'd never been someone who had migraines. But what I realized is by walking on my tiptoe, I had thrown my hip out of balance, which had thrown my back out of balance. And what that had done is it had gone all the way up my spine and was actually triggering those migraines. But had I not figured some of that out, I would have looked what stressful thing is causing these migraines. What is going on in my life? And I guarantee I would have found something, even though that was not likely the culprit. Because once I actually went to the podiatrist and had them remove that source, everything fell back into a cycle. And I'll add, even in that, I started popping Aleve like they were whatever, just to deal with the headache and the pain, which then started causing kidney problems, because that's another issue with overuse of NSAIDs in males, can cause a lot of kidney issues. So it's, if we don't really know and we don't go to the right place to check, we attribute meaning, and we'll self-diagnose inaccurately a lot. So at that point, that's where I think it's the humility piece comes in, to humble yourself enough to go to talk to somebody to get a good understanding of what's really going on under the hood.
So there may be even like physical things that you're experiencing, which that would be a circumstance, a situation, something physiological or physical within your body, but then you assign meaning to it, like you're filling in the blank to make sense of it, which may be an erroneous thought that's creating more pain for yourself.
When I used to do a lot of work in the chronic pain space and talk about the psychological impact of chronic pain, and an analogy I would always use is a balloon, right? If you sat in a room full of people and everybody took one breath and blew it into that balloon, right? At the end of the circle, you dare anybody to say whose breath is whose in that balloon. All it would do is it all contributes to the fullness, the pressure, everything else. And what our bodies are amazing at is discerning pressure, pain, and discomfort. What our bodies stink at is figuring out what the source is, or attributing ownership for that pressure. What winds up happening is your body looks for the outlet. If the balloon gets full enough, it will pop. And so it's which faucet gets turned on to release that pressure, because you're looking at a pressure release. But then so let's say I was having that back pain or that heel pain that led to back pain that led to migraines, right? Anything that would have happened right then at work or anything else that would have frustrated me would have been starting at an 8 or a 9 on my scale, because I was already at that level of pressure. And I would have said that work stress is what made me a 10, when really that work stress made me a 2. But it was added to the rest of it. Figuring out like that there's a lot going on that you may not be aware of, or maybe your baseline is you live with a 4 on that pressure scale as your norm. And you don't even realize it because you think you manage it pretty well. But then when you get to a 6, you start to fall apart. And it's a hop, skip, and a jump from a 4 to a 6.
How do you think someone can tell the difference between when they're going through a difficult emotional season, or whether it's a diagnosable mood disorder where they should like seek out some professional help?
I guess what I would say is situational things tend to stay situational. And if they get more pronounced, if they linger, if you've been dealing with that anxiety and it's lasted, it's progressing into a second or a third week and it has not abated, it has not given you any kind of break, that's becoming extra, right? If none of your previously relied upon strategies to help you cope, going to get a massage doesn't work, working out doesn't work, doing your favorite thing doesn't work, then I would start to say, maybe I need to talk to somebody. And at first, maybe talking to somebody can just be, I need to talk to a friend. I need to talk to family. I need to talk to my pastor. I need to talk to somebody just to get insight, because the reality is sometimes we are too close to the situation, right? You overlook it. Or with a depressive thing, if someone you care for gets a terminal diagnosis, you're not supposed to bounce back in 5 days. You're supposed to struggle with that. But if you can't get perspective, if somehow, no matter what you're doing, it just feels like you're slipping and sliding, and no matter how hard you work, you can't get back up. I used to equate depression to climbing up a gravel hill. And if you lose your footing on a gravel hill, it does not matter how hard you claw, gravel rolls, right? So it's like effort sometimes just will exhaust you, but they can't necessarily stop that slide. And we all need a ledge. We need a foothold sometimes that allows us to catch, regroup, and then start climbing again. And for some folks, that can be that friend. That can be that person who just snaps you out of your perspective and says, hey, no, you're overlooking this, or hey, you're missing this. And sometimes that's all it takes. But at some points, maybe you do need to go and just talk to a therapist. Maybe at some point you need to have that discussion with your primary care provider about whether a low-dose antidepressant might be the thing that kind of provides you that ledge to start climbing. And what's really amazing, and I don't think people perceive this, is as you climb, if you've got the support in place, right, as you start reclimbing that gravel hill, if you've got the good supportive friend, therapist, whatever, or the right medication, as you climb, the ledge follows you. So that backup kind of is there. So when you slide again, you don't slide quite as far as you did. So it's making, and then what you hope is when I reached the end of this episode, whether it's a situational or a clinical episode, right? Then now I've got a tool in my toolbox that tells me when I need it again, I know what to go to. It's crutches that you walk on while the bone heals, but you don't just throw them away when you're done. You put them in the closet in case you ever need them again. And that's what I think folks need to realize. It's just, I think, those sort of things, whether it's professional therapy, whether it's psychiatric meds from a primary doc or psychiatric consultation with a licensed psychiatrist, I think those are just tools that are at our disposal.
And what about the tool of coaching? Obviously, I'm a therapist, but I market myself as a coach. How do you see coaching and therapy overlapping, and where do they diverge?
What I think is really interesting, because as you've been on this sort of progression in your career, is one I've taken interest into, and I've started thinking, because in a lot of ways, I think some of what I did in counseling was coaching in nature, but I don't think I realized that at first. The way I think about counseling is more, let's look at your current situation, let's deconstruct your past and see what contributed to your present. There's a lot of backwards gazing in counseling, and coaching is more, let's look at your now. What is contributing to this situation right now? And let's come up with a game plan. It's just like if you ever played a sport. I think that's why they call it coaching, right? If you ever played a sport, we're not worried about what happened 4 games ago. We're worried about what happened right now in the first half of this game we're playing. And we want to sit there and tear it down and say, okay, when this happens, how do we change that pattern so that it doesn't continue to happen moving forward? If that team kicked your butt for the first half, how do we make sure it doesn't kick your butt in the second half? And then hopefully we're having a game plan that then preps you for the next game ahead of time, because we're dealing with some of that stuff. So counseling and professional counseling, I think that it's hugely helpful. And I'm not trying to minimize it. I spent 20 plus years of my life in that space, but it is a lot more backward gazing than forward planning. And so that's how I break it up.
Yeah, I think that's what really resonated with me with coaching, is it seemed to be a lot of the approach that I took to things already. And so even if people ask me, what's the difference between if you're coaching someone or counseling someone, it's hard for me to answer that, because I think my approach is the same. I think the biggest difference is if you're counseling someone, a lot of times that's even more insurance based, especially if at our private practice, people are coming in, they have insurance. You have to start with the DSM because you're looking for a diagnosis to give them so you can bill that to insurance. So even the nature of all of that begins with looking at more of what's wrong here, what's the problem, which obviously we want to know what the problem is. Whereas sometimes I would feel, I think, limited or not always connected to just starting with the DSM of what's the pathology. But I would say the approach that I would do working with counseling clients, someone who is experiencing depression or anxiety, I'm teaching them the same tools that I would be using with someone who may be functioning really well in life, but they're struggling maybe in their relationships or some adjustments to situations. I feel like the tools are the same, although with counseling, some of those clients may be needing more medication management or bringing in some extra tools in that regard to help with the biology.
Those are really good points, because I really do think the overlap is obvious, right? But I think it is that, how did we get to here? Versus where do we go from here? And I think counseling does a little bit of both of that, but it is so much more on deconstructing, where I think coaching is more about constructing. So for some folks, I think either way, I think I could see where counseling would trigger them to want to get into coaching more, because then they don't want to do as much belly button gazing. They don't want to do as much digging back into the past to identify things. They want to just
belly button gazing.
It's when you're just meaninglessly looking at something that does not necessarily give you anything. If you're just gazing at your belly button, you're never going to see anything different. You might find some lint, and you're trying to understand what it is. There is no biological purpose for the belly button after the umbilical cord is cut, but it's that. So that's why I'm sorry you've never heard that phrase before.
It sounds really boring. Okay.
But there you go. But I think that's what it is. It's like an investment of time that goes nowhere. And not that counseling does that. And some people really need that. Some people really need to be able to say, where did we start? Where was the beginning of this? And I think for folks, I think coaching would do the exact same thing. While I'm coming up with my plan, I really want to figure out why I keep falling into this rut.
I always think if we think about moving forward, like what am I moving toward? You're giving your brain direction to go, and that's where we start. And then what are all the obstacles that come up, which are a lot of times are your thoughts. It goes back to your thoughts, your beliefs. And so the past may come into that. The past doesn't exist anymore, but there may be thoughts about the past. If you went through some traumatic event, it may have had a traumatic effect. I think our brains are always trying to bring the past forward. We just want to carry those bags forward, even though we say we don't want to be there anymore. The brain can get stuck on past thoughts. And I think the past thoughts are relevant insofar as how they are affecting how you're moving into the future. So a current thought that you're having would be a current thought that you're having. But I think people get stuck in unforgiveness because they keep holding on to the past. And so I'll see that even with couples clients, we keep going to the past, we keep going backwards and trying to drag stuff forward that happened 20 years ago. And it may be relevant in so far as it's shaping thoughts that you're having about the future. So we can't ignore the past, but I think the approach is different of how you redirect that as a counselor, a therapist, a psychologist, and as a life coach.
Yeah. I think I started to realize, like, in those 20 years of direct clinical services, I started realizing my approach and philosophy was shifting with my clients, with my patients. And I say all those things because, just so people know, when I worked in a mental health center, they were clients. When I worked in a medical setting, they were patients. And now that I work for an insurance company, they are members. So it's exactly the same thing, but it's just the frame of reference. Even in my counseling, which I think was becoming more coaching at that point, was I wanted to look less at the behavior and more at the motivation for the behavior. What was the intended goal? What was the expected outcome of those behaviors? It's not so much how you did this, it was why you did this. And because I became a big believer in, are you running from something or are you running to something? And when you are very fast focused, it's a lot of, I'm identifying the monsters in the closets from childhood. And the monsters in my closet as a child are not still there. A lot of people are still in those behavioral patterns based on avoiding those past traumas. And so the motivation piece is, what are you trying to achieve right now? Because if you're trying to make your mom happy and your mom's been dead for 15 years, right? That's an effort of futility. If you're trying to earn the respect of the person who humiliated you in elementary school, you are spending a lot of energy for very little reward. It's okay to at some point realize, hey, I have this low self-esteem that probably is related to something from my childhood, but what am I doing with that now? And where do I go from here? And I think that's where coaching has a unique opportunity, that it doesn't demand you to spend 3 years to get to the now. It lets you start from the now.
Yeah, it's always redirecting your brain forward, recognizing the brain's tendencies, which does rewire the neural pathways in your brain. So even if you're struggling with anxiety, depression, we're wanting to rewire these pathways that have been ingrained in your brain, which can be harder for some people than others, depending on the chemistry, the biology, the neurotransmitters, all of that aspect. One thing that I think is interesting about whether you're seeing a therapist, a coach, is when you set up an appointment and you go meet with someone, some people are going to click better with different personalities than others. And by what I mean by personalities, I think that also includes the approach, how you work with a client. I think you and I, in one sense, I would say we have very different approaches. I'm more structured. I like to give people structure and processes, but I would also say I'm very relational as well. How would you describe your approach to working with a client, whether they're dealing with a clinical diagnosis or they're looking just for personal growth, emotional support?
I guess my thing is, I strive to be really collaborative. I strive to establish that relationship. I try to use humor a lot as an effort to disarm, because I know there's a heightened degree of stress and anxiety even in seeking help, whether it's as a counselor or as a coach. So I want to make it as safe as I can from the beginning. I also, I think, avoid using big words. I try to make things very just conversational and experiential. I think I try in my sessions to almost trigger some sort of a physiological experience they might be having by either planting them in a scenario or doing something like that. May not be the exact scenario they were in, but it's roundabout ways to get them into a similar mindset so that they can process things that maybe would be triggering without them being so triggering. When you and I first met, we worked in the child welfare space. One of the things that I really hated was feeling that while I think folks were working the system as they were required to, not everybody was as invested. And a lot of times as children's division worker assigned to that case, I felt like I was held very responsible for the outcomes of all my families, which I should have been. I should have been responsible, but I shouldn't be the sole source of responsibility for that. And I felt like there was not always equal effort, that some parents were more invested, some parents were more willing to do some of the work. And when I got into the direct clinical services space, it was all I wanted to be able to, I wanted to shovel, I wanted to help somebody dig a hole, but I wanted them to be digging with me, right? So I really want, and I think in my counseling and my coaching, I want it to be a mutually enjoyable process. I want it to be hard, but I want them to see me working just as hard as they are. But yeah, I'm not the structured sort of a therapist. That was never my jam. I was much more of, I wasn't going to go here, but you just said that. So let's just follow that rabbit trail for a while. And again, once I think I got to that point of what are they running to? Or are they running to anything? Or are they just running from? Then I just want that aha moment. I want that epiphany. I want them to have that. I want to leave the trail of breadcrumbs that gets somebody to that point where they see it. Because you talked about the restructuring of the neural pathways and stuff. And what I would say is just as empowering or as important is sometimes it's just restructuring the behavioral responses to some of these things, because you can't unsee something. And that's the best thing to me. We all do it. If we see the stain on our shirt that we didn't know was there, we'll see it forever. And even after we have it removed, we'll think we see it ongoing because it was once there. If you have the misfortune of walking in on one of your parents in the bathroom and you didn't know they were in the bathroom, you will never unsee that, no matter how much you want to unsee that. And I believe that sense of self, if we can sit there and help somebody identify that aha, that's what I've been doing. That's exactly what I've been doing all this time. Or you're exactly right. That is what I was trying to achieve. And how was I expecting that to work?
Like helping people gain insight.
That insight, that aha insight. And I don't want it just to be the aha is the exciting piece, right? Because then they're like, oh my gosh, how did I miss that all these years? But then you want to hammer into that a little bit and say, okay, now what do we do with that? What do we do that I see this tendency? And so I always like to think that when I was in as a therapist, even as a coach, when I see a few folks here and there now, I want it to, as Silly says, I want it to be fun. I want it to be a fun experience about an unpleasant topic or an unpleasant time of their life, because then I think it becomes experiential. That hammers in more of the effect of what you've done.
Yeah. No, that's great. I think that's good. Your clients always love you. You always have clients who stay with you for decades. The point is, not all your clients. The point is to work with them, help them get well and move on.
Well, and to that point, though, you said the rapport. Not everybody clicks with everybody. And that is very important. I have had people who do not click with me, who need more structure, who ask me for more structure. But I think it's also important to recognize that I don't want to be insincere and inauthentic either. Whoever somebody goes and talks to, if any of your listeners decide they want to go and see a counselor or a coach, I always encourage people. Some people you have a natural affinity for and you click instantly, right? And you're like, this is like the best friend I didn't know I had. Other folks is, I don't know how I feel about this person. But my rule of thumb was always tell somebody to try it 3 times.
I always say 4. Give it
4. There you go. Jill says 4. Then go with 4. But my thought was at 3, you will not figure anything out. You will not cure anything. You will not resolve any major life conflicts. But you will start to realize, could I click with this person?
Yes.
And if you can click, you will click. It's just probably one of you is just off kilter on something. But after 3 or 4 sessions, if you don't click, you probably ain't gonna click. And if that's the case, then don't keep pouring money into that.
I think people will do that. They'll stick with either a process or a person or
a medication.
Or a medication that's not working, thinking, oh, eventually this will click. Or a diet. I've stuck to diets for a long time thinking, okay, eventually 8 months later, maybe this will take effect. Okay. But sometimes I think we have to evaluate and think there may be some other options out there. Now, you don't want to give up too quickly on a process. And that's where I like to think, go meet with someone, give them a few sessions, and then decide what's working, what's not working. Sometimes you just might not like the process of creating change. And that's different than maybe not relationally clicking, which I think, speaking to that a little bit, there could be a lot of healing in relationships. So I teach a lot of mind work of looking at your thoughts, seeing how they impact your feelings and your actions. We would say a lot of that's cognitive behavioral therapy. But I think bringing a spiritual component into that is really helpful. And the relational component, like people knowing you care, being able to empathize and have this human element, I think all of that is so important for our healing, as much as looking at, how food's affecting you and exercise, and maybe you need some medication. Like, that's why God gives us the whole body, all the different parts to together. My mind just keeps going back to how beautiful that is, of how it may take, our answer may not be in one thing, but there is a relational aspect to our healing. And I think that's intended. I think God allows it to be that way for a reason.
And I think that's the whole point too, is as much as we are the same, we are the same in no way at all. What works for one person may not work exactly the same for another. Or you could hear about Jill Lillard is the best coach they'd ever had in their life, and somebody could come and talk to you and it just does not have that same connection. Or someone says, Effexor was the medication that saved my life. And so then you go and you ask for your script of Effexor and it does not do the same thing, right?
I make it worse.
Yeah, it can, because I think we're all different, right? We're uniquely and wonderfully made, but in that we're unique, right? It's like fingerprints. Nobody's fingerprint is the same. When I did that work in chronic pain, one of the things that was always interesting, and it was something I never thought of in this psychological line of work, but it was how fast do people metabolize medicine? Because everybody's body is different, right? Some people are fast metabolizers, or are they metabolized different? So any medication that comes in your system, you may metabolize at a different rate of speed than I do. And so I'm expecting that in the same 15 days I saw the change in you, I'm going to see that same change in me. And maybe it was dopamine that was impacting one person and it's serotonin that's impacting someone else.
Yeah.
Because those neurotransmitters do not always work exactly the same, because even though they have the same intended thing, we're all unique. And so it's figuring it out.
Yeah. And I think that's where the training I recently did with a Amen brain clinic, and looking at diagnoses like addiction, depression, anxiety, he would just say there's all different types. So, just to diagnose one person with depression and give them an SSRI, something that's going to affect their serotonin, that could cause a lot of harm to someone else without knowing what's going on in the brain. And that's where like a medicine like Effexor might help one person, and another is going to be ineffective. They're going to feel worse, and others it may feel neutral. So though you may have some similar symptoms, there may be different parts of your brain that are more overactive or underactive. And so I think that's what he's looking at. He's looking at blood flow to the brain as far as what medications might help. And then he also talks about supplementation. So if we look at it as a continuum of care, where here's the symptomology that you're experiencing, we can start with some talk therapy, lifestyle changes, just getting more sunshine and walking, maybe changing your diet a little bit. Then we may want to add some supplements. And if you're still struggling, then you may need some medication. If you're using all your tools and you're still struggling. So I guess that's a question I'll ask you. When do you think it's time for someone to get a medical evaluation instead of just trying to do more thought work or therapy or coaching or spiritual practices? When is it time to maybe talk to a doctor?
If you're a hammer, everything's a nail, right? So it depends on who you're talking to as to what their perspective is going to be. There's research that talks about how amazingly beneficial medication is to managing depressive symptoms, anxiety symptoms, whatever. But then there's alternate research out there that says that a lot of that overall benefit is because it is so beneficial for some that masks the fact that it's not as beneficial for others. So there's no panacea out there. There's no automatic cure that fixes everything for everyone. So my first thought is talk to someone first. Having those talk relationships, whether it's the friend, the counselor, the coach, the pastor, whatever, there's less of a chance that is going to change some sort of a chemical structure in your brain to trigger side effects. Because the other thing I always think is important to recognize, every medication we take is a man-made attempt to replicate something that our bodies make naturally.
Yes.
Right? And the challenge with the man-made piece is they all trigger side effects because they are not God-made, they're man-made. If you start with the medication, sometimes I think you're opening yourself up to the side effects that come with that medication. The weight gain, they talk about with some adolescents that antidepressants can actually trigger some additional depressive symptoms and things of that nature. So I usually say if you're going to do it, and if you're at a spot in your life where the urgency that sometimes comes from I'm at the point of life or death, then yes, medication may be the first course. If someone's in the ER, they need something like that. But if you're at that point of where I'm just trying to discern whether this is slipped into a clinical versus from a situational sort of a thing, another set of eyes never hurts. right?
Yeah.
Having a trusted partner who can help you navigate that, I think is good.
Well, and if you're like questioning that, and I think one of the questions would be going back to something we pointed out at the beginning, which is if you're feeling this way more than you're not feeling this way, if like more than half the time you're feeling this way and it's been going on for a long time, then it's probably time to go talk to a professional, which can help you make that assessment.
Yep.
It's something you want to try.
If the single situation has lingered for a long period of time, or you consistently find yourself in a rerun of that episode, like this keeps happening, to me, that is another indication of, again, the car keeps making the noise. If it happens once and goes away, then maybe it's not a big deal, right? But if it keeps happening, at some point, is it my duty to look into that? And not every squeak in your house means the house is falling down or that someone broke in. But at some point, you might want to get up and check. And so I think lingering or repetitive, I think, are two times that I would tell you to probably go and just brainstorm, just collaborate on the assessment. And sometimes the other piece too, whenever folks say, I'll just talk to my friends, that's great. But at some point, your friends have a vested interest in you getting better too, because the basis of that friendship is some sort of mutual partnership, right? You're the one they always go to for advice. So they can do that now, but at some point they need their advice giver back. I want you to get better for you, but I also want you to get better for me because I need a friend back. And I think the professional piece, the talking to a stranger, and there are air quotes there since this won't be video, but the talking to a stranger piece actually has a benefit because the counselor, the coach, whatever, they have no skin in the game other than to help you get insight and fix this, right? And if it lingers, they can get frustrated just like you do, but it's not for the same purpose or reason that family or friends can sometimes.
You're not meeting their need.
Yes, which is, I always talk about my brother. My brother had a loss once in his life. My brother's passed away now, but it was years and years ago. He had a sudden loss. And I'm a clinical psychologist, for crying out loud, right? I can help him through this. But after about 3 or 4 weeks, I needed my brother back. And the fact that I couldn't help him get back frustrated me as much because I couldn't help him as much as I needed him. Right. Mm-hmm. So it was that sense of that awareness of my limitation. Like I could not be the person to help him navigate that. I could initially, but I reached that limit quick because I had to be honest with myself that my capacity to not be his brother was
really hard. It's hard to help your family. It's hard to help your family members. What's that scripture of a prophet's not even recognized in his own town?
Yeah.
Okay, not that we're prophets, but I think sometimes people around us don't appreciate your gifts and the things that you do. And it's because your role is different. I just want to be a friend to my friend, or you just want to be a mom, or you just want to be a brother. Your role isn't to be therapist, coach, and they don't want you to be that, to them.
I always remember when Sawyer was little, when our son was super little and he had a lot of anxiety. I remember talking to him one night and I was just giving him some little behavioral techniques. I said, you can just do that. And he goes, that doesn't work, Dad. And I'm like, yes, it does. He goes, no, it doesn't. And I said, Sawyer, that works for everyone in the world. And he said, no, it doesn't. And I literally was sitting there trying to argue with a 6-year-old, use my doctorate in that topic as an indicator.
Hey, I had my own situations with Sawyer. I was trying to do a relaxation exercise. Okay, we're going to close our eyes. And I was walking through my visual of a tree planted by living water. And it was supposed to be, and then he was like, the tree's going to fall on me.
Yeah.
There is resistance. There's resistance.
Yes. I think I was just trying to teach him breathing. Let's just breathe through your nose and out your mouth. Let's just do the diaphragmatic breathing. See if your chest or your stomach moves. And fighting with me that it doesn't work. And anyway, but again, that's just evidence of sometimes you're too close. And I would say start with close, but then recognize at some point I might need one extra step, one extra degree of distance, right? Mm-hmm. And that degree of distance, while it comes with a sense of lack of knowledge about what it's going to be like or who that person is, it adds the perspective because being removed eliminates those emotional connections that I think sometimes filter perspective.
Yeah, no, that's.
But so I would encourage people start with the talk therapy most of the time. If it gets, like I said, if you're having hardcore panic attacks, things like that, sometimes things have to be a little different. But start with the talk therapy. Have that person help you analyze it, and sometimes it might even come from your primary care doctor. Hopefully, your primary care doctor, who most people talk to their primary care doctor more than they talk to anybody else. I think I saw a stat one time that said 80% of depression is diagnosed at the primary care, even those who have had a mental health evaluation.
Yeah, because they're pretty good, I think, at doing a screening.
One, I think some people think there's a pill for that. I think some people really think, just like a headache, just like everything else, if I go in and say I'm feeling down, they'll give me a pill, I'll take it, I'll feel better by the end of the day. And
so you're saying talk to your primary care doc, but you're not saying your primary care doc's going to be your therapist, because they will not.
It can't be. No, they can't.
Yeah.
No, but they could be.
They only get so much time with you. They're on insurance. You only get them in and out real quick.
There was the other joke when I went to be a psychologist instead of a psychiatrist. There used to be a joke of Jill was talking about the difference, and really the difference is the ability to prescribe. But the joke always was, what's the difference between a psychiatrist and a psychologist? And the answer was 45 minutes. Because a psychiatrist saw people at 15-minute med refill appointments, where a psychologist saw folks for 60-minute counseling appointments. So that was the joke.
Yeah. And so I always think, too, don't expect a psychiatrist to be like a warm and fuzzy person. Oftentimes they're not. But you can just go even through, if medication is something you're considering, that may be something you can do through your general practitioner.
Most prescribed by them.
Most of them are, and some are more comfortable with that than others. Now, certainly if you're having more complex stuff, you would want to see a psychiatrist if your medication issues seem to be more complex. One thing I guess we were talking about was doing talk therapy or coaching, talking to someone. What I find too is if you're getting those tools and if you're getting that relationship, that sounding board and that place to sort through things, and you're really struggling, you're not finding that you're making progress, or even the tools that you're learning, it's very hard for you to implement it or to even make lifestyle changes, walking up that
gravel hill.
Walking up the gravel hill, then that is where you might need some medicine. And if you are taking medication, I would like to start with amino acid therapy or looking at supplementation, things that are going to looking with a practitioner who can help you with that. That may be a ground too. If you don't want to do medication, that's going to be more natural. And I'm always a fan of that. But some people are definitely going to need medicine. But one thing that we learned is the best combination, if you are taking medication or doing supplementation, is the combination of doing counseling and medication. Don't just go get on some medicine to fix things and not do therapy where you're learning new ways to think so that you're actually rewiring your neural pathways through your thought work.
Yeah. And I'm not going to quote it because I don't have that data accurately in my head, but there are studies out there that talk about the limitations of each, right? Of talk therapy and of psychiatric medications. But what's funny is there's also evidence that talks about the combination of the two, the impact is greater than the sum, right? Like if these are both, say 40% effective, how can the combination be greater than 80% effective? But it typically is. And I add it to that, what I said about the gravel hill. It's the ledge, right? For some folks, that medication becomes the ledge. It stops the slide. But then as you do the thought work, as you do the counseling or the coaching, you climb, right? And then the floor follows you. Because without that ledge, the floor is the bottom of the hill. If we can generate a new floor, then but that's what the medication will do, is it'll give you a floor. I don't always think the medication gives you a new ceiling. I think that's where the counseling, the talk therapy help you climb to the ceiling with the support of the medication for the folks who need it.
Yeah. And you were saying earlier, some people want to just go get a medicine. I just want a pill to make me feel better. And then there's other people who have a big stigma with it or don't like taking any type of medicine, or there's some fear around it. Do you want to speak to that a little bit?
It's understanding the medications as well, but right? Because the antidepressants, the psychiatric medications, while there are some that have more of an impact, an immediate impact, some of the anxiety meds, the benzodiazepines sort of hit hard, right, to help with anxiety. But those also, because they hit hard, they end hard. And when they end hard, that's where I think there's a lot of risk for addiction. There's a lot of risk for dependency and whatnot on that. But
anti-anxiety medicine.
Like the Xanaxes, the Ativans, those types of medications. So what's important to realize, like about antidepressants, for instance, is they are not immediate drugs. They are not the Aleve in your medicine cabinet. They are not going to give you relief in 15 minutes to an hour. Those have to get to a certain level in your blood system and a prolonged period of time to have the impact to change this. Because again, situational depression is one thing where it's just this situation caused me to get depressed. Clinical depression lingers. So you can't just take a pill once and have it impact. You're going to have to build up in your system to be able to manage that sort of a thing. So understanding that it's not apples to oranges. It's not like I take the shot of insulin and my blood sugar goes down and I feel better. It's going to take longer for the medication. So I think If you
No,
get
you're
to
saying
that,
longer. We're not saying, oh, take this for 6 months to see if it's working. It's more of a matter of weeks.
it should be me. It should be like,
Whereas an,
yeah.
whereas an anti-anxiety, you might notice an instant effect, but you don't
Yep.
want to always do that either, because then you need more and more
And then it becomes,
factor with the
yes,
data.
and it does.
Yeah.
And psychological dependence is as real as physical, because you think you need that because you feel it right away. But the other thing that's important to know too with the like antidepressants, right? And since we're talking about antidepressants, and this is what's really strange, is things like serotonin, right? Serotonin is one of the big neurotransmitters involved in depression and a lot of different things. The majority of serotonin that is in the human body is located in the gut. It's located in your intestines. It has with digestion. It adds to everything else, right? So when you take a medication that spurs production of serotonin, it's not just affecting the serotonin in your brain. It's affecting the serotonin everywhere. Someone gave me the analogy of it's almost trying to fill a glass by flooding a room, right? Like I put the glass in the center of the room and I want to get water into that. So the way I do it is I flood the entire room and let it overflow the edge of the glass, right? So you're going to have the reaction in your gut of that serotonin, likely before it gets to your brain. So when folks have
So what does that look like?
folks have side effects, the abdominal side effects, the nausea, the everything else, right? Because, and some people will say, oh, this is making me sick. And I'm like, well, it's actually working on the serotonin, but it's just not at the level or to the location that you're getting the desired effect of that kind
Is
of.
that something that goes away?
Yes, it does. It's the same thing. It's like your body wasn't used to that. And so now it's adjusting to an influx of it for that area. So it's recognizing that those sort of things, and you're right, it's hard to say, again, because people metabolize at different rates, how fast someone should see an impact, but it should be a matter of weeks. It should not be that you're committing to 6 months of these medications. But what I also tell people is because there is a leveling up, there also needs to be a tapering off of these medications. So it's like if you've started antidepressant medications, you would probably want to give yourself a 3 to 6 month window to try it and see what the impact is, right? And then let your body adjust and then come down. Because otherwise you're just providing it something that gives it an influx, but then takes it away too soon. It may cause another kind of a jarring effect. So it's with any kind of psychiatric meds, for the most part, you're committing to a longer test. Maybe not with that exact medicine, but with medications in general.
And I like to think of it that when you say a test, I like to think of it that way, like for people who are very resistant to medication, but they've tried a lot of different things. Once again, I like to start with, are you getting sunshine? Are you exercising?
Yeah.
Or let's do this brain work. But there's some people that are struggling so much, it seems like you may want to try medicine. You may want to go talk to a doctor and just explore that as an option. And as far as running a test, I like to say, don't think you're committing to this forever.
No.
Just say, I'm going to try this for the next 3 to 6 months, and then I can reevaluate.
And what I would say is, while you're doing that, have that person, that trusted person you're talking with, right?
Yeah.
So that you can remove the things that you keep tripping over out of the floor. So that those behavioral changes can be made too, so that there's less triggers for a recurrence. Because if you're prone to clinical episodes of depression, it's possible that situational things can trigger one of those because it feels the same. You know? And so what you want to do is you want to identify what could be going on in your life to help remove those. So as I get back to my health, I'm not going to just start tripping over those things right away again. And then if you do stop the medication, you still have the supportive person there.
Yeah.
That at first you might be seeing them weekly. By the end, you might be seeing them every 3 months, just as sort of a check-in. Again, a coaching exercise.
And it can help, I think, having that person, having a therapist that you're talking to, because if you're starting a medication, your doctor's not going to see you on the regular. They're going to prescribe something
Every
and
3
then
months.
they come back in 3 months. So I think having a therapist who can even make observations of what they're noticing of, hey, I've been noticing since you've been taking this medication, you're telling me you're not sleeping at night, or they may notice more irritability or more heightened behavior, because sometimes someone who goes on an antidepressant, it could trigger like a hypomanic episode or elevate things. And so you may not even put all that together of other side effects or things you're experiencing. You might think, oh, I feel better, I have more energy. But this other person that you're talking to regularly might notice that you're having some sense of elevated mood that's causing some other
Sure.
problems. So I think, yeah, that gives you more of a partner who you can see weekly if you need to, who's going to give you feedback of maybe what they're noticing and say, hey, let's maybe call your doctor
Yeah.
and let them know this and see what they want to do. So
If people can find opportunities, if they're getting like that kind of professional help from the counseling world, where the medical and the mental health, the behavioral health folks are actually collaborating, is the best. For a medical provider to be willing to dig a little deeper, sometimes they want to have the person they can pass it off to and it gets out of their comfort zone, right?
Yeah.
And the same thing's true. Like for those 12 years I worked in a medical clinic, I was more comfortable digging in on something like, are they managing their diabetes? Because then I could immediately go and get one of the doctors to help manage their diabetes. And the doctors were more willing to ask an additional question or two about their depression or what's going on in their life, because they knew that if they hit that nerve, they could then have me pop into that appointment to help assess and have an option. So I think it's the integrated approach really is important. And I think medicine's moving that way much more. It's just a slower progression to cover it all.
So for someone who's listening today and they're wondering, could this be me? Am I struggling with more of a mood disorder?
Yeah.
What would be a good first step for that person? Where should they start if they think they may be dealing with something more than a situational situation?
I would say whoever is available. So if you have a primary care provider that you see on a semi-regular, talk to your primary care provider and say, hey, I'm wondering about this. But recognize again that some doctors, they're used to giving out medication. So they might start with the medication piece. But again, I'm a therapist. I've been a therapist my whole life. So I think the idea of finding that trusted person to talk to would be your best bet, whether that's you reach out to a medical place and ask them if they have counselors, if they have therapists. You talk to your church and see if they have therapists or they know therapists or they do some sort of counseling. And I think that's the best bet. If you can find places like that have integrated approaches. And for most people who may not even realize this, federally qualified health centers all tend to have behavioral health and physical health located in the same roof. So that those are always good places to reach out to. Your community mental health centers, all of those places have therapists at the ready to be able to at least assess, start the process of walking with you to try to analyze this. But I'd lean to the talk therapy as the first thing for people to look at.
What are some simple, practical things that can support someone's mental health right away, even if they're not ready to start therapy?
Change, I think some sort of investment in self and health are important things, right? Whether that is just increasing your activity level, whether that is trying to get some sunshine, whether that is getting out of the cave that our homes can become and having some social interactions, maybe with one or two trusted, safe people, things that just behaviorally change, because the definition of insanity is doing the same thing over and over, expecting a different outcome. And a lot of times when we get into those funks, we just pull the covers over our head and expect to Rip Van Winkle it and wake up and it'll all be different. And so I would say doing something when you don't want to do anything is sometimes the important piece. It's pushing into a discomfort so you can come out the other side. I'm an analogy person and people are probably sick of my analogies, but I always think that it's when you're driving on the road and the rain comes down so hard you can't hardly see the lanes anymore. And there's always some people who pull over to the side of the road and just stop. And if the people listening are one of those people, I'll apologize now if I offend them. But I've always thought it is much better, even if I have to slow down to 2 or 3 miles an hour and hug the shoulder, I'll get out of the storm 2 to 3 miles an hour faster. The storm may slow me, the storm may inconvenience me, but I don't want to give all my power to the storm. So I think that's the challenge. So it's I don't feel like doing this, but I'm going to go walk. Now, typically I might have walked a mile. I may just go check my mail today. I would rather just stay in the closet with the blinds closed and not talk to anybody today, but I'm going to go sit on my back porch for at least 15 minutes. I don't want to think about what God wants from me or what the Bible says about this, but I'm going to listen to the Bible app and at least hear it read to me today. It's pushing into discomfort, I think, is the challenge, as opposed to just expecting it to go away.
Okay. Do you have any final words of encouragement or truth you want to leave with the listeners? Or maybe that woman who's out there, maybe she's feeling discouraged, ashamed, or wondering, am I always going to feel this way? What would you say to her?
I think what I would tell anybody in any of those situations is what you're feeling makes you human. This is not making you defective. Mood swings don't make you bipolar, they make you human. Episodes of sadness just make you human. We live in a fallen world. And I think the challenge of all that is, what do we do in that fallen world? It's funny that in our pain, sometimes there can be arrogance in our pain that we tend to push everybody away and don't let anybody know, or we don't admit some of our pain. I think having the humility to accept some necessary intervention, big piece too. So what I would say is reach out to somebody. Don't suffer alone. Don't analyze your suffering. Just accept that we're going to suffer, but you don't have to suffer alone.
Oh, good. For you guys listening, I hope this conversation gave you a deeper sense of clarity and, most of all, compassion for what you might be walking through. I want to thank, again, my husband, Rich, for joining me today. And thank you guys for being here, listening, and doing the brave work of healing and growing. I'll see you guys back here next week as we continue the Hormones, Happiness, and Holy Spirit series. We're going to get into the work of the Holy Spirit. How does the Holy Spirit work within us emotionally? Until then, take care of yourselves and keep leaning onto the one who holds your mind, body, and spirit in perfect love.
I'm so glad you joined me today. If you'd like to know more about me and how we can work together, just head to thehappiestlives.com. I work with individuals, couples, and groups of Christian women who are ready to grow, heal, and live with more clarity and joy. While you're there, you'll find resources you can get free, like my podcast guide, the mini course, The 4 Things You Must Do to Become the Happiest Wife, and a link to join my monthly newsletter so we can stay in touch. Again, that's thehappiestlives.com. I'd love to connect with you there.